Well, hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and one of the MCs here at Gold. And at Gold, we have been busy working on a new lecture pack titled Forming Comprehensive Conversations about Breastfeeding Challenges. And with me here today is one of our speakers, Zoe Faulkner. Welcome, Zoe.
Lovely to be here. Thank you very much for inviting me to be part of this session.
Oh, it is lovely to have you here. And you're, of course, part of the lecture pack. This lecture pack right now is an add-on package to our Lactation Online Conference, and we get started on April 3rd. I will talk a little bit about that more later. And but first of all, Zoe, where in the world are you?
Well, I am based in the UK. I'm on the south coast in a town called Brighton. It's a very young town. We've got two universities, a large LGBTQI population, and a birth rate of around about 3,000. So I'm quite busy here.
A lovely community there, a seaside town there, and as you mentioned, young and wonderful. So lots of work for you there. So let's talk about your background. We are, of course, at the, this is the topic of lactation. So tell us a little bit about your professional background and what led you then to the presentation in a moment.
Okay, so I think like many people, actually my own feeding experience led me into the feeding support world, initially through the voluntary sector. But I've been working within my local NHS trust now for over 16 years. So I work within the community team supporting families. And during that time, I then became a lactation consultant. So for 15 of those years, I've actually run the peer support program. And then in the last year, my role has changed to really focus on supporting the complex needs that we see in Brighton and Hove, and also supporting the implementation of baby friendly. But I have a number of other roles as well, but that's my sort of substantive post.
That's wonderful. I love that you also talk about peer support. That's so important, right? Because
absolutely
out there in the community and really doing wonderful work. I feel like often we don't give the peer-to-peer support enough credit there.
No.
So thank you for mentioning that as well, and talking about your background there. Now let's talk about the presentation you have here at Gold, Weaning from Breastfeeding, Why Timing and Methods Matter. And I find that fascinating. It's an interesting topic. And I feel like the topic is often overlooked because as lactation consultants and professionals, many of them are busy out in the field helping parents get started with lactation or overcome lactation problems, challenges and such. And very little is talked about weaning. So tell me, first of all, how did you get interested in the topic? And tell us a little bit more.
Yeah, I think really, as you just outlined, I think even families think that they can't come to breastfeeding groups, breastfeeding drop-ins, breastfeeding services to end breastfeeding. I think, there's a real perception out there that breastfeeding is all about overcoming challenges and getting you started. So, I think it is about having that in our toolkit and really understanding the complex range of needs and the range of experiences and what weaning can look like. It's as unique and individual as that breastfeeding journey. And I think we do need to kind of up our game when it comes to supporting conversations around the ending of feeding. And I think what particularly interests me when I think about my work locally, directly with families, is that we know in the UK that 80% of women stop breastfeeding before they wanted to. So that's also really important in terms of understanding how we can help them to have better endings. We also want to help more of them to be successful, but for some of those women, we want to help to reframe what's happened and to have a better ending, because we know that it has a lifelong impact on how they feel about their mothering, how they feel about their children, not their individual children, but their experience of those early years. It's so profound and important. And I think the ending to a journey is just as important as the beginning.
I love how you said that the ending of the journey is just as important as the beginning. And I feel like it is also a little bit of a gap in knowledge and education because many parents don't number one, maybe not want to think about the end, or think like the end or the weaning is something that just happens naturally, oh, we're just focusing of, oh, it's going so well, and eventually it will stop. Isn't that usually what kind of people think, right? And then it's not like that. And as you mentioned, then families feel like there's nowhere where they can find support.
Absolutely. And I think even, there's that, you can see that sort of muddle and mix up in an individual's journey as well, where, actually breastfeeding is reduced. Maybe it is about 3 times a day. And then the mum pumps and she panics because her milk supply is reduced. But actually that's physiologically completely appropriate for where they're at in their journey, and actually supporting that perhaps lower level of milk production and feeding for quite some months even might be part of that very gradual process towards weaning. It's really understanding weaning is not, it's not just that last feed, it's that whole process. Which can be, a convoluted up and down journey. It's not linear. It's really got to respond, as I've talked about, to those individual circumstances, which might include bouts of illness when feeding intensifies again, or, a change or a holiday. Those sorts of things are going to disrupt a process.
Disrupt a process, and that can maybe look like the baby is weaning when the baby really isn't, right?
No, exactly.
What is the word, like nursing strike or whatever it's called, right? Or disease or something happen, and then the parents thinking, oh, we're ready to wean, what's happening here, but then it really isn't, and there's not really somebody there to support them. Because
absolutely. And I think a feeding strike's really a very interesting one, isn't it? Because I think it's understanding that a child can go quite a few days without going back to the breast, or only feeding at night, or only feeding in a really low stimulus environment, but actually be quite distressed going to the breast during the day. And sometimes there's a real physiological cause. You might see that the child's not well, they've got possibly got an earache or sore throat, so you can kind of make sense of it. And sometimes it's less explainable. But I think feeding strikes are really important to understand, that they can happen, and for a family to hold their nerve. And to just keep going, keep offering, and for the mum to not feel rejected, because I think that is so commonly the experience, is that sense that their child's rejecting them. And that's where they need the champions that we can be for them, as well as their family, to say it's okay, hang on in there, there's something else impacting your child, this is not about you, there's something else impacting this relationship right now, and to just stick with it and to give it that bit of time. And the child usually comes back to the breast very happily.
Absolutely.
But we got to keep that window of opportunity open.
The window of opportunity open, that's right. Now, there might be cases also when weaning happens, and maybe it is a combination of issues, or maybe back to work, or mother is sick, or there is some surgery coming up, or other kinds of issues that can be very traumatic for the parent, because maybe the parent, as you mentioned earlier, many when they're not ready, really, it happens, the weaning, and they feel like they have no support, because they feel like they're being shamed if they go back to any of the breastfeeding support groups. Why are you doing this? Why are you not working harder? What's, things like that. So there is very little for these parents. They are very, I can imagine, emotionally fragile and vulnerable in that moment, to catch them, kind of to nurture them, right? What have you seen?
Oh, absolutely. But I think this is really where, I talked about peer support earlier. I think this is where often those more specialist services are really pertinent and appropriate. And certainly thinking about my local work, I would be expecting those women in those more complex circumstances to be coming to the specialist service and seeing an IBCLC lactation consultant, or someone with that kind of level of breastfeeding specialist skill, to support them through a more complex emotional experience experience. And there is a really important aspect to our work, which is about counselling,
Yes.
listening, and that really person-centered care to help to navigate and unpick and to be with those really sad and difficult feelings, and to be comfortable with that, and to allow the mum to experience those feelings in a place of safety, and also consider what the options are, and have we explored and examined what all the options might be.
Yes.
Because often there's more options than a family might first realise. Often
Right.
the line is a little bit further down the line than the family
Yes.
realise. And things like a surgery, it's often an interruption rather than a weaning. So there's ways of navigating things that might present as a need to wean with the right skills and information.
Exactly, the right skills and information, and giving options, because the surgery comes to mind as it can be the interruption. It doesn't have to be the end, but sometimes if there, let's say, is a surgery and there is medication involved, and the time that some parents might think, oh, taking that I cannot breast or chest feed. So but being with an expert, being with an IBCLC helps to show that options and give support. Yeah, absolutely. Well, Zoe, it was so lovely speaking to you here today and having you here. And I have to say, I loved your presentation. I had a little sneak peek earlier on, titled Weaning from Breastfeeding, Why Timing and Methods Matter. Thank you so much for being here with me today.
Thank you so much for having me.
And for our viewers now, as I mentioned, this is a presentation and a lecture pack that is an add-on to our GOLD Lactation Online Conference. And we are going live at that conference on April 3rd with our open access keynote presentation that is totally free of charge to anyone. So make sure you sign up for that and find out about all the other wonderful presentations in the conference. And of course, this amazing lecture pack with Zoe here as well, where she is presenting, has a presentation part of it. And I would like to invite you to go to goldlactation.com to find out more about all the timings, everything you can find out there. It's going to be fantastic. And I can't wait to see you all there. So thank you for watching, and bye-bye, everyone.